So a boxer's fracture is the reference to when someone were to punch something and break their hand. With that scenario, they'll break a bone in their hand. Fortunately, that bone a lot of times can be treated without surgery, but it does require care and treatment. The primary symptoms are pain and swelling, the inability to make a fist a lot of times. Sometimes there'll be some rotation in the finger, so when they try and make a fist, the fingers kind of spin on each other. Those scenarios are ones where we definitely want to see them sooner than later because we can correct that. So the bulk of the time with a boxer's fracture, we can treat that in a splint to start, and when the swelling goes down, we place them in a cast. And I think people heal very well from this injury. Usually the cast is less than a month's time, and then a removable brace, and then most people can get back to life. So a lot of times they'll present initially to the emergency room or to a prompt care or an urgent care facility because their hand is swollen. And then the x-rays will be taken, and a lot of times they'll be sent to us at that point for definitive care. When you come to the office, you have to be prepared for a couple things. One is that potentially the fracture has moved, and so sometimes we may have to manipulate that in the office. The other thing is casting. So a lot of times we'll put someone in cast, so I think being prepared for the fact that you may go home with a cast, and being able to let your work know or your school know, or et cetera, that this may change the next month or two for you. I think those things are very important to do before you get there.